Bismillahirrahmanirrahim. Today we will discuss the diseases of the salivary glands. Most of the diseases of salivary glands, they are tumors. But before we go on to the tumors, we discuss about the infectious diseases, that is adenitis. Most of the cases of adenitis, they are viral in origin. And the virus is mumps virus. These patients, they present with bilateral enlargement of the parotid glands, and sometimes they also suffer from mumps architis. And these viral infections, they spontaneously settle after some time, but the males may be sterile as a complication of mumps parotitis, and most of the times parotid glands, they are affected. So then is the term xerostomia. So xerostomia means dryness of the mouth, and this is due to reduced secretion of saliva by the salivary glands, that is parotid glands, submandibular glands, and sublingual glands. And xerostomia may be due to multiple causes. It may be a part of a syndrome that is called Sjogren's syndrome, in which there is also dryness of the eyes due to destruction of the lacrimal glands. And along with this dryness of the eyes, there is dryness of the mouth and involvement of the salivary glands, that is parotid glands mainly. This is an autoimmune disease in which there is lymphocytic cell infiltration in the parotid glands, and there is destruction of the parotid glands. So that is xerostomia. Then there may be stones in the duct of the salivary glands, that is hyalolithiasis. So that these are the non-neoplastic diseases of the salivary glands. So let us go on to the tumors of salivary glands. One thing you must remember is that most of the tumors of salivary glands, they are benign in nature. About 70 to 80% of the tumors, they are benign. And about 15 to 20% they are malignant in nature. And classification of salivary gland tumors. So there are two main groups, that is, one is benign and other is malignant. Benign tumors include, number one, the pleomorphic adenoma. It is about 50% of the salivary gland tumors. Then is WARTHIN'S tumor, 5 to 10%. Oncocytoma, 1%. Other adenomas like basal cell adenoma and canalicular adenomas, they constitute 5 to 10%. And then is duct papillomas. So these are benign. I repeat again, the benign tumors, that is pleomorphic adenoma, WARTHIN'S tumor, oncocytoma, other adenomas like basal cell adenoma and canalicular adenoma and duct papilloma. Among the malignant tumors, the most common, that is about 15% of the malignant tumors, they are MUCOEPIDERMOID carcinoma. Second common is adenocarcinoma, not otherwise specified. They constitute 10% of the malignant tumors of salivary glands. And third one is acinic cell carcinoma, 5%. Adenoid cystic carcinoma, again 5%. Then malignant mixed tumor, 3 to 5%, and squamous cell carcinoma 1%, and other rare types of carcinomas, they are 2%. So this is about the classification of tumors of the salivary glands. So let us take one by one. So the most common tumor, as I said, is the pleomorphic adenoma. It is also called mixed parotid tumor. And pleomorphic adenoma, they are common in the parotid glands. And the cell of origin is the ductal epithelium and bioepithelial cells. They are called mixed tumor as there are different types of tissues in the tumor. There are epithelial components, and then there are mesenchymal components. The mesenchymal components may be myxoid areas, there may be chondroid differentiation, there may be even bone formation. So that is why we call it as mixed tumor or pleomorphic adenoma. So morphology of pleomorphic adenoma, grossly these tumors, they are round and well demarcated masses. Size of the tumor may reach up to 6 centimeters. They are partially encapsulated, and they often recur if there is less complete excision of the tumor. So they are recurrent if they are not removed completely with the wide margin of normal tissue. Under the microscope, there are epithelial elements and mesenchymal elements. And epithelial elements may be in the form of ducts, acini, tubules, or strands or sheets of epithelial cells. And the stroma is mesenchymal or loose myxoid tissue with areas of chondroid differentiation and even sometimes bone formation. So this is the microscopic appearance of pleomorphic adenoma: epithelial elements and mesenchymal stroma. So this is the clinical appearance of pleomorphic adenoma. They may rise in the minor salivary glands as well, in the oral cavity. And they present with a well demarcated, mobile, discrete mass in the oral cavity. And this is another presentation of pleomorphic adenoma. There is a swelling just below and behind the ear lobule. So in the region of the parotid gland. And this is the microscopic appearance. So there are epithelial elements which may be in the form of ducts, acini, or there may be sheets of epithelial cells. And these epithelial cells, they are embedded in a loose myxoid stroma, and which may be partially chondroid differentiation, or sometimes there may be even bone formation. So this is the microscopic appearance. So this is another view of pleomorphic adenoma. Here you see well-formed gland-like structures lined by epithelial cells and separated by loose myxoid stroma. So second benign tumor of salivary glands is the WARTHIN'S tumor. And this is the second most common tumor of salivary glands. And it almost always occurs in the parotid glands. Age of the patients, that is 5th to 7th decade. and commonly it occurs in the males, and 10% of the tumors, they are multifocal, and 10% they are bilateral. So one thing about the Warthin's tumor is that there is a high risk of this tumor in the smokers, almost about 8 times there is high risk of Warthin's tumor in the smokers. So gross appearance of Warthin's tumor, that is round to oval encapsulated tumor mass, which may range from 2 to 5 centimeter in diameter, and the cut surface is pale gray with cystic or cleft-like spaces, and these spaces, they are filled with mucinous or serous secretions. Microscopy shows cystic spaces lined by double-layered epithelial cells. Surface cells, they are columnar with abundant eosinophilic cytoplasm, and these large cells with eosinophilic cytoplasm, they rest on basal layer of cuboidal to polygonal cells. And then there is dense lymphoid stroma. These epithelial cells, they rest on lymphoid stroma. So this is the diagram showing the cystic space, which is lined by double-layered epithelium. The outer cells, they have abundant eosinophilic cytoplasm, which rest on cuboidal to columnar cells. And these double-layer epithelium, they rest on lymphoid stroma. So this is another view of Warthin's tumor. So there are cyst-like spaces, and sometimes there may be even papillary structures in the lumen of the cystic spaces, and these are the lymphoid, dense lymphoid cells, lymphocytic cell infiltration. Warthin's tumor is also called papillary cystadenoma lymphomatosum due to the characteristic microscopic appearance, that is papillary cystadenoma lymphomatosum. So there are papillary structures, there are cyst-like structures, there is lymphoid tissue. Papillary cystadenoma lymphomatosum. This is another name of Warthin's tumor. So that is the Warthin's tumor. Then other benign tumors, oncocytoma and other adenomas, they are less common. Oncocytoma it is composed of cells with abundant eosinophilic cytoplasm, and under the electron microscope, this eosinophilic cytoplasm is due to abundant mitochondria. Oncocytoma. This is a benign tumor of salivary glands. Oncocytomas can also occur in other areas like in the kidneys as well. So then is the malignant tumors of the salivary glands. That is the most common one is MUCOEPIDERMOID carcinoma. MUCOEPIDERMOID carcinoma of salivary glands, they constitute 15% of the salivary gland tumors, and 60 to 70% mucoepidermoid carcinomas, they occur in the parotids. And it is the most common malignant tumor in children. That is second malignancy in children after the blood leukemias. Gross and microscopic appearance of mucoepidermoid carcinoma, there may be mass formation with infiltrative margins and size may be up to 8 centimeter. Cut surface of the tumor is pale gray white, and there may be small cysts which contain mucin. And under the microscope, there are 4 types of cells which are present in mucoepidermoid carcinoma. One is mucin secreting cells, other is squamous cells, intermediate cells, and clear cells. And the proportion of these 4 types of cells, that varies according to the grade of the tumor. And these cells, they may be raised in the form of cords, sheets, and cystic spaces. And some tumor cells may be regular and benign appearing. They may be highly anaplastic depending on the grade of the tumor. And grading of mucoepidermoid carcinoma is based on the number of tubules formation, number of mitosis, and anaplasia. And there are low grade, intermediate grade, and high grade tumors. So there are 3 grades. One is low grade, intermediate, and high grade. So this is the microscopic appearance of mucoepidermoid carcinoma. There are small cyst-like spaces which may contain secretion, and they are lined by mucin secreting cells, squamous cells, intermediate cells. So this is another slide showing the microscopic appearance of mucoepidermoid carcinoma. That is, there are again small cystic spaces, and then there are intermediate and squamous cells. So again, this is another view of mucoepidermoid carcinoma. So on these slides, they show the various grades of mucoepidermoid carcinoma. And second malignant tumor is adenoid cystic carcinoma. This is an uncommon tumor of the salivary glands, and 50% arise in minor salivary glands. And they are highly malignant tumor. On gross examination, they are small, poorly encapsulated gray-pink lesion. And under the microscope, there are small cells with dark, compact nuclei with scanty cytoplasm. And these cells, they are arranged in the form of cribriform pattern, tubular pattern, or there may be solid pattern. And there is basement membrane-like material. One characteristic feature of adenoid cystic carcinoma is perineural invasion. So this is the microscopic appearance. So there are small gland-like spaces which are lined by small cells with hyperchromatic nuclei and scanty cytoplasm. And this is the pink basement-like material. So this is adenoid cystic carcinoma. And this is the perineural invasion. This is a nerve, and here you can see the tumor cells present on the side of a nerve. Perineural invasion. So this is another view of adenoid cystic carcinoma. Again, small cells arranged in the form of cribriform pattern and small duct-like structures showing perineural invasion. So that is about the malignant tumors. Then there may be carcinoma arising in pleomorphic adenoma, which is also called malignant mixed tumor. Pleomorphic adenoma, if it is long-standing, sometimes there may be malignant transformation, and this is highly aggressive tumor, that is malignant mixed tumor. One point you should remember is that the chances of malignancy of salivary gland tumors is inversely proportional to the size of the salivary gland. For example, most of the tumors of the parotid glands, they are benign, while most of the tumors of minor salivary glands and sublingual gland, they are malignant. That is adenoid cystic carcinoma. So the size is inversely proportional to the chances of being malignant. So that is about the tumors of salivary glands. Thank you very much. This is